Get informed. Get educated. It's all about your health. This is Healthy Living with Dr. Lateef Akinola.
Hello, good day. I'm Dr. Lateef Akinola, consultant obstetrician and gynecologist at the Medicine Specialist Women's Hospital. You are all welcome again to one of our series of podcasts, Healthy Living podcast series. We are here at the Lagos University Teaching Hospital, office of Associate Professor Kehinde Okunade, MD, FWACS, FMCOG, FICS, and he is an eminent researcher, a thoroughbred clinician, and an astute administrator. He wears many caps, and he is currently the subdean of Faculty of Clinical Sciences, College of Medicine, University of Lagos, and is also the chairman of the Medical and Dental Consultants Association of Nigeria, LUTH chapter. He is also an honorary consultant obstetrician and gynecological oncologist at the Lagos University Teaching Hospital, Idiaraba, Lagos. He wears many caps. As I said, he's a clinician, eminent and astute researcher, and an administrator. I want him to introduce himself briefly so that we can know much about him. Thank you, Prof, for accepting to be one of our guests today. Yes. Prof, could you please kindly introduce yourself to our audience?
Thank you. Thank you very much, sir, for having me on your show. It's quite refreshing that I'm being interviewed by somebody that I also look up to in the medical profession. Of course, specifically in my specialty of obstetrics and gynecology. Yes, my name is Dr. Kehinde Okunade, just like I've mentioned, and I'm associate professor of obstetrics and gynecology at the College of Medicine, University of Lagos. In terms of course, like you've mentioned, I wear so many caps, academic research, and of course extracurricular, and of course even administrative wise, not just within the College of Medicine, but at the Lagos University Teaching Hospital. But more importantly, the part I want to emphasize is my research area, which is actually my role, more importantly, at the Center for Clinical Trial Research and Implementation Science, which is actually the pioneer clinical trial and implementation science research institute in the University of Lagos. And even when you look at the whole of the country, it actually stand to talk with most of the big research institutes in the country. So most of my activities are actually carried out, as by virtue of my affiliation with this institution. I came from a very humble beginning. Interestingly, as an obstetrician, I did set out that way. I wanted to actually be a physician, a cardiologist at the beginning. But along the line, while I was, building my career, I fell in love with obstetrics and gynecology. But today, I focus mainly on the gynecological aspect of obstetrics and gynecology, which is more importantly gyne oncology. So I currently function as the head of the gyne oncology unit not just at the College of Medicine, but at the Lagos University Teaching Hospital. So that is me in a nutshell.
Okay, thank you so much, Dr. Okunade. Now, as we said, you are wearing many caps. Clinician, professor, administrator, astute researcher. How do you combine all this together?
Thank you very much. I think I'm not going to say it's quite easy. It's never easy to function effectively in all the roles. But one thing I believe in is the the power of teamwork and, of course, delegation. I always believe in delegating activities. As I currently sit here, there are many activities that I'm supposed to be managing that I've delegated people to do that after, of course, having trained them in different capacity to be able to function even when I'm not there. So I believe so much in delegation and delegating to people that have learned from you. And also, and of course, the power of building a team that can, that can function even in my absence. And that's, even the idea of even coordinating that team is challenging on its own. But once you have allowed them to be able to become independent, to own that activity by themselves and not to be overbearing, activities can go on even when you are not there. But more importantly, I also provide that leadership that is necessary, make every member of my team comfortable, not just in terms of remuneration, but in terms of making them comfortable, handling certain responsibility that ordinarily people may not want to, give to them. So once you give everybody that sense of ownership, then it becomes very easy for activities to go on even when you are not there.
That's fantastic. As I know, and I can attest to that, a good leader should be able to delegate. A good leader should be able to lead, and give his team members, the array to work and independently and come up with ideas that, can be modified to the benefit of the whole team. I know that clinical research anywhere in the whole world is not, something common that everybody tuned to. Only people with special interest in, doing clinical research. What motivates you to go into that line?
The motivation, I didn't set out to be an academic right from the beginning. I actually wanted to finish my residency program and of course go into private practice. But of course, I have mentors that insisted that maybe you have the potential, even when I didn't see it in myself, that believed so much in me. I felt, you belong here. And of course, because of the respect I have for such individuals, I had to then, of course, explore the possibility. And of course, when I landed in academics, I looked at the whole setting and of course, try to explore where I can function maximally within. And of course, I see that what you need to function as a researcher is to be able to, come up with idea that will have a public health impact on the long run, and ideas that you put into research that that will actually impact the public, impact practice, doesn't come cheap. It's required that you need quite, a number of resources to be able to put that. And part of resources is not just money, but you need a team to be able to actualize that. And I start building that right from the beginning. And of course, I also then part of what I also feel that we also need to come on board. Of course, the money is very important, and the money can only be obtained. You can't use the money out of pocket to do that, because the money that we get as academics is nothing to write home about. So I had to, explore every possibility to, to be able to, write research proposal, and of course to be able to get grants to be able to execute that. But writing a research proposal too, and to get a grant doesn't come easy, because the idea and the skill to be able to do that doesn't come overnight. So, and of course, that is when the need to be intentional about also building my own capacity also comes in. And of course, I invested in myself, went for training abroad. Not just clinical training, but research training. And so over the first 5-6 years of my appointment as a clinical lecturer, was invested in going for training abroad, and of course investing a lot of my salary, sometimes even having to borrow money, because some of this training require a lot of money to be able to. So and of course, at the end of the day, I also appreciate my institution for also investing in me to actualize that. The problem with academics generally in Nigeria today, because we are not seeing so much investment. So I was fortunate that people were able to invest in me, and of course I was able to get that skill. So the motivation really comes from the fact that I realize that I'm already in this setting, and I need to function maximally. So that's enough motivation for me to go a step higher and see what I can do better than every other person around me, so that I'll be able to achieve what I have in mind to achieve, which is to be one of the topmost researcher in my area of specialty in the country. And I can say without any fear that to a reasonable extent I've been able to achieve that.
Yes, I can. I completely agree with you. You are well revered when it comes to research in Nigeria. I mean, gynecological research and other areas as well. Now, broadly, tell us about your areas of research.
Yes, my research generally focuses on the clinical and epidemiological, understanding the clinical and epidemiological correlate of female genital tract cancers, which includes, of course, also looking at clinical trials to be able to, identify intervention to be able to cure some of this, to prevent and cure some of these female genital tract cancers. I also look at the intersection between clinical epidemiology and molecular genetics, so that because generally now most only 2% of the world genetic database include the information of Black Africans. So now what I'm trying to do is also to contribute to that particular database, so that African genetic information can actually be represented within that database, so that when we are developing personalized intervention, we can also develop some for our own population, so that we don't use the genetic information of Caucasians, of people in North Americans, to develop intervention for ourselves that may not necessarily work effectively in us because of our genetic differences. So, and that is what I generally focus on. Yeah.
Fantastic. You are completely right. It's 100% that it's difficult for us to transpose clinical research findings from Europe, from North America, when you think about genetics, and also when you think about ethnicity and racial disposition. I completely agree with you, and I'm really, at least agreeing with you on the fact that we need to have a local standard. When we are doing clinical research or any treatment at all, we must, base it on local priorities, our racial tendencies and ethnicity, as well as our genetic composition. You are quite with me. I'm quite with you on that. Now, focusing on your current research, what are you currently researching on?
Yes, it's quite a number of work ongoing. I think at every point in time, I am and my team usually have about 3 to 4 studies going on simultaneously. And now I'm actually on an NIH funded grant, which is looking at the performance of a particular genetic or molecular marker, which is P16Ki67, to see how that can be used to screen HIV-infected women for cervical cancer, at least to detect before it happens. So what we are doing is to compare with the currently available screening method, which of course include pap smear, include the human papillomavirus testing, and what is locally available to us, which is visual inspection with acetic acid. So we are looking at this molecular marker to see whether it performs better than all the other methods that are currently available among this special population of women living with HIV, because these women are much more vulnerable to developing cancer faster than women that do not have HIV infection. So we are focusing on this group of women to see whether this marker will work better for them, so that we can actually reduce the burden of cervical cancer that we see among this vulnerable group of women. So that's one project, which is a 5-year project that we are doing. We are currently in the 4th year, and we have the 5th year to go to next year. We also have 2 clinical trials going on, and one of them is actually looking at the use of a topical application that comprises of a combination of 5-fluorouracil and imiquimod, cream that can be used to treat women that have pre-invasive lesion of the cervix. That means what we call precancer. So basically what we are doing is to, you see whether this method, which should be cheaper than what is currently available, does not require so much manpower, does not require so much resources like electricity. You don't need to apply that cream for a woman that has been diagnosed as having pre-invasive cancer of the cervix and treat at that point without then having to pay so much money and have without so much complication, like what is currently obtainable with the standard method that we have now, where women that are within reproductive age, if you use the current method to treat them, they may have a condition that we call cervical insufficiency that may predispose them to having preterm labor and delivery in subsequent pregnancy. So this topical application can actually prevent us from having all those complications among women of reproductive age. That is the second study that we are currently conducting. So we also have some other studies which are actually focusing on women that having preeclampsia. Preeclampsia is a hypertensive disorders of pregnancy, which women have elevated blood pressure and sometimes with urine, with protein in their urine, which can be associated with some complication, which not just for the woman herself, but even for an unborn baby. So we are actually developing a model. That model will look at the model is going to be developed to see which women will develop preeclampsia with severe fissure. And what we mean by that is that women that will have severe complication. So that model will help us to be able to develop some kind of algorithm that healthcare professionals can use in the future to categorize every woman as low risk or high risk in the future, so that we can identify those that will develop the condition and intervene before they develop that complication in the future. So we also, based on that preeclampsia, we also have another clinical trial going on there. We just got that funding about 2 months ago. So we are currently in the process of getting ethical approval, regulatory approval, so that, but that will focus mostly on the use of a particular drug. We are repurposing a drug that is being used for treatment of paracetamol poisoning. And that drug has been found to have some antioxidant property, and of course, oxidative stress is one of the characteristics that we see in the preeclampsia. So if you're able to arrest that oxidative stress using some antioxidant medication, like this drug we are looking at, we call it N-acetylcysteine. So we are looking at it in a clinical trial to compare it with a placebo, which doesn't contain any active ingredient, to see whether it will help to prevent women that have preeclampsia from developing to severe preeclampsia. So the people we are enrolling in that particular study will be women that have preeclampsia, which have never been done anywhere before. So we want to see whether that drug can slow their progression or can even prevent progression to severe preeclampsia, as the case may be. So that hopefully will be starting in the new year in 2026 January, and we hope that we'll be able to generate a lot of evidence that can lead to change in practice going forward after we are completed. It's a 3-year project, and we hope that by the completion, of course, it's going to contribute to practice.
This profile is, very, very useful, very wide-based, and it's literally going to, address many of the endemic or prevalent diseases in Nigeria. You are looking about HIV. We have quite a significant number of patients are HIV positive, and you are looking at genetic predisposition to develop cervical cancer, which is fantastic. 5-fluorouracil as a cream to prevent, cervical cancer development in those who have CIN1 and 2. That's also fantastic. And you are looking at preeclampsia, which is very, very prevalent in our environment. And this, hopefully, I pray that your research findings will be, very applicable, cheap to apply in our local settings. Thank you for that. Now, out of all this research, which one do you think can be scaled, and applicable in our society, that can prevent, all the bad publicity, morbidity, and mortality, across, our nation?
Yes, thank you, sir. That's a very, very, very important question. I think we are usually very intentional. We are quite deliberate about what type of study we do. And the study is the most important thing about any proposal that we write. Is about what is the local relevance of this. Is it addressing a local problem, a locally prevalent problem of cervical cancer? It's quite prevalent in our environment. We have about 14,000 new cases of cervical cancer in Nigeria. And of course, out of these, about 2/3 of these women will succumb to the disease. So it's a big problem. The incidence is even higher in women that are HIV positive. So it becomes a disease of national importance to us, because a lot of our women shouldn't be dying because of a preventable disease, because cervical cancer is preventable, or if only women can be screened, if vaccination can be adopted. And that is what we are trying to do. And of course, preeclampsia, I don't have to tell you about that one. Preeclampsia is one of the contributors to maternal mortality in not just in Nigeria, but all over the world. And we feel that it's important that because as it is currently, there have not really been any effective intervention in terms of even prevention, even though there is the adoption of low-dose aspirin, calcium in areas that are calcium deficient. But the intervention to prevent and to treat is not really, really so much, can be considered to be that effective. So even beyond preventing it, what of those women, even because we have seen that despite the fact that we give a lot of women that are considered to be high risk, this aspirin, this calcium, a lot of women still develop the disease. But how do you now prevent them? It is not developing the disease that is the problem on its own. It's actually those that will become severe, that come with complications, serious maternal and newborn complication. And that is why we focus on those that have the disease and preventing them from progressing forward to becoming severe, so that the complication can be prevented and we can reduce the undesirable maternal mortality and perinatal mortality and morbidity that accompany this condition. So before we dabble into any, of course, as a team, we sit down together and look at what else should we be looking at. And as we have decided that we should focus on those conditions that are locally relevant, that are of high burden in our setting, address them, and contribute our own, our own data to solving this problem. And that's why we are doing what we are doing.
Thank you. To conduct a clinical research, as you mentioned, you need a team. And I understand you have C3's organization. You help me with to break down the acronym that is established by you and your other colleagues, especially Professor Bosede Afolabi. She is also somebody that we all look to when it comes to research in Nigeria. And I believe that establishing this association of researchers, bringing all of them together, those who are in gynae, those who are in epidemiology, those who are statisticians, those who know a lot about clinical trials, will go a long way to buttress research achievements in Nigeria. And of course, bringing them to reality, taking them out to people who need the findings so that their morbidity and mortality ratio can be reduced. Now, what is the achievement of CC3s so far in Nigeria?
Okay.
I know about
yes.
IGON trials,
Yes.
which is fantastic.
Okay. Thank you, sir. Well, just so that I can, the acronym CC3 stands for Center for Clinical Trial Research and Implementation Science, domicile in the College of Medicine, University of Lagos. Like I stated at the beginning, is actually the pioneer clinical trial and implementation research institute in the College of Medicine, in the University of Lagos, and of course in Nigeria generally. Of course, we pride ourselves for being a center that not just conduct groundbreaking research, locally relevant research, but also build capacity of future clinical trialists and implementation scientists. So we have a director of the center who actually happens to be the founder. That's Professor Bosede Afolabi, FAS, a renowned professor of obstetrics and gynecologist, and a mentor to myself. So of course, the center also has some deputy director. We have two deputy directors, one in charge of clinical trial, another one in charge of implementation science. Those are also renowned professors. One professor of hematology and blood transfusion is in charge of clinical trial, and of course, a professor of public health is the one in charge of the deputy director in charge of implementation science research. I happen to be the phase 1 and phase 2 clinical trial lead, along with two of my other colleagues. One is in charge of phase 3 and phase 4 clinical trial lead. And of course, we have another person that is the lead, specifically for implementation science lead. So our role is not just to conduct, clinical trials, implementation science research, but also to build capacity of future scientists. We are known to conduct the largest clinical trial in the country. I'm sure you've heard of the PIP-SICU trial, the IVON trial, the IVON PP trial. Then currently we are conducting what we call the HAZIN-V trial, which is looking at the role of azithromycin in preventing postpartum sepsis or puerperal sepsis. So basically, these are very large clinical trials. Sometimes they're enrolling over 2,000, 3,000 participants, and they are mostly trials being done in centers, in sites in Nigeria. And of course, so what we are, and of course, the report of these trials, for those that were conducted, have been published in very high impact journal like Lancet Global Health, which will be the first time, in the country that will conduct local study that will be published in, in high impact journals of international repute. Of course, we can't claim that we are doing this alone. Of course, we also have collaborators from all over the world. More importantly, from University of Nottingham, United Kingdom. Just yesterday, we have some of our collaborators coming to the country to also, do a presentation for faculties, students as a whole in the College of Medicine. And of course, talking about how to design and manage clinical trial generally. Addition to Professor Kate Walker, who is a professor of Obstetrics and Gynecology, and of course, Professor Eleanor Mitchell, who happens to be a professor of clinical trial from the University of Nottingham. Of course, they did justice to that topic yesterday, and a lot of our people were able to go away with critical information, enriching information that will not just help us to, to position ourselves as the number one research university in the country, but all over the sub-Saharan Africa. So what we are doing now, we have quite a number of other trials coming in by virtue of other collaboration, but so that we don't let the cat out of the bag yet.
Yes,
we'll be discussing that.
Yes,
in another...
I understand that. Now, can you, educate some of our audience? What is clinical trial?
Yes, thank you very much. I think that's a very important question. Well, clinical trial generally, let me start as a whole by what do we even mean by research? Research is just a way for us to be able to collect data that will, of course, the process of collecting that data, analyzing it to be able to, of course, for generalizable knowledge so that we can say, yes, it can help us to change practice, to change policy, and how practice in the way that we manage our patient. But when we look at certain intervention that have never been tried or that have been tried for other reasons, but we want to see whether it will work for certain other condition, in a way that we'll see whether we'll look at the safety of that intervention. It can be a drug, it can be a diagnostic method, it can be a procedure, maybe a surgical procedure. So when we look at how the safety of that intervention and how it works, then we are doing a clinical trial. But of course, the most important aspect of clinical trial is to do it like a randomized control trial. That sounds a little bit technical, but the most important thing is that when we do studies, there are certain things that can affect our results in terms of, can I say, biasing it, or can distort that finding in a way. I will call them confounders. Confounders are probably some kind of, other factors that if you put them into consideration, will definitely affect your result. But if you have to remove those other factors, for instance, can I say that maybe alcohol can cause brain cancer? If somebody that is an alcoholic is also smoking, can I categorically say that it is not the effect of the smoking that is causing the brain cancer and not the alcohol alone on its own? So if I remove the effect of smoking from there, completely exclude it, maybe alcohol does not cause brain cancer, and that's what randomized control trial can do for us. It helps us to remove the noise, or what we call the confounders, from that relationship, so that we can know whether that relationship is actually factual or it is not factual. And that is what we do. It's a very complex, very...
So you won't be able to give us,
yes.
That one can take several hours to explain. Thank you so much.
Yeah.
Now, doing a research, whether clinical trials or laboratory bench research, demands a lot of ethical, ethical need for the researcher. You must be, ethically well grounded, and you must, get ethical approval for all that you are doing. And then there's a need, to validate what you are doing. How do you bring is it difficult to obtain such ethical approval?
Yes and no. So it's a mixed bag. So let me break it down a little bit. The most important thing is that for us as researchers, because for every single patient, participant that will bring into our study to collect their information, we are holding that information in trust. And that information cannot go to a third party. But even before getting to that point, every single member of our team that can have access to participant or patient information needs to have undergone certain level of training in ethics. And you need to have been satisfied that you have gone through that training. And that training entails you knowing about the need that to protect the participant that are the patient or people that are participating in your study. And so it emphasizes the need for informed consent, the need for, understanding the benefit of patient participating in the study. And of course, knowing that the benefits should outweigh the risk of them participating. The need for privacy and confidentiality of their information that they give to us, and the need to also ensure that everybody can have should have equal chance of participating in your study. Not that you selectively, focus on a particular population and leave out other population. You don't want to be conducting your study only among a certain group of people. Many people should be able to benefit from your study.
Inclusivity, sort of.
Yes. And the only way they can participate in your study is if their data, which is unique to them, is represented in your study. So that whatever information you get from there is relevant to them too. Because I'm not going to use the information of people in Ikoyi and they want to extrapolate it to people in Mushin. It may not work that way. So people in Mushin should, because they have different socioeconomic status, different, way of life compared to people in Ikoyi. So data from Ikoyi may not be applicable to them. So they also need to be represented. So if I'm going to be doing a study, so that justice needs to also be upheld. Everybody,
and then you must not do any harm to
your research
subjects.
Exactly.
Okay.
So we thought that, so we ensure that everybody goes through training, and of course, at the end of the day, of course, they put it into practice. We also observe them to do it in the process of enrolling a participant into our study. Do you take consent? Do you record the consent? Do they sign? Do you give them a copy of the consent form? Do you allow them enough time to be able to digest the information? They know what they are entering into, and of course, all the information that is contained in the study is also given to them. Let them know what is expected of them. And of course, that nothing should be hidden. And of course, it should be that information should be passed across to them in a language that they understand. I'm not going to start using Queen's English for people that live in Ajegunle that probably speak a lot of, pidgin English. I'll probably have to use the kind of language, translate my consent form document in a language that they understand. So that is what.
Thank you so much. Now, as eminent clinician, administrator, researcher, lecturer, professor in gynecological oncology, how do you balance work and life together? Work-life balance.
Well,
do you spend all your time in the research office, or you still have time to go and socialize?
Yes, I've been asked this question quite a number of times. I'm not going to tell you that it's a straightforward answer to that question. It's not straightforward. Sometimes we have it easy, sometimes we don't have it easy. But more importantly, like I mentioned at the beginning of this interview, is that there's a need to have a team. And the team should not be about me. It should be about what we can achieve together. And of course, also delegating appropriately and leading from the front. Yes, I do a lot of the dirty work as members of my team. I go to the field sometimes to also, do the same thing they do. Maybe not all the time, but I do it so that they know that if I can do it this way, this is the way it should be done. So I lead from the front. But yes, we try as much as possible to also ensure that the other aspect of life does not suffer. Family, social interaction. And I do it as much as I can. But I will tell you categorically, sir, that something must suffer if one needs to be able to get to that point where we want to get to. But we also try to remind ourselves at every point in time that there is always a need to create that room to also, for family to enjoy us. But I will tell you that it's not.
Okay, as a good astute clinical researcher, looking at the future, what really motivates you every day to continue along this line?
Yeah, personally,
what excites you about future research?
Personally, and I will use a small story to emphasize that. Sometimes ago, my 10-year-old, when he was in school, actually told me that he told his classmates that his father is a doctor. His father is a very, very senior doctor. Like you can see him. If you Google his name, you see him. And so that his classmate happens to come to our house, and of course, he opened a laptop and of course Google my name, and of course it came out. So sometimes the motivation is that you want your kids to also be proud of you, proud of what you are doing. And that is one motivation, which is personal. Part of the motivation is also to see the good you do, the public good you do by, conducting groundbreaking research that will change life, that will change policy. And then when you see your contribution out there changing the direction in which, the policy on treatment of certain condition goes, you feel that sense of fulfillment. So the motivation is about fulfillment for me. So once I see my work, being used for public good, it's enough motivation for me, and I want to do more. And that is so. When you look at personal perspective, of course, it's always there. The personal perspective is always there, and of course, at the same time, we also want to also get to be the pinnacle of the profession, so that everybody knows you as a renowned researcher, as a scientist, and they give room for people to want to have a lot of quite a number of the research I do. It's not because I write a proposal now. It's because people found my name somewhere and they feel that I'm somebody they can collaborate with because I've done something related to that. And I see a lot of people that also want to be mentored by me. And that is also as a role model. So they come virtually every week. I see somebody coming around that I want to be mentored by you, whether it's a medical student, whether it's a resident, whether it's somebody that is even people that are not in my area of specialty come to me that they want to be mentored, they want to study me, they want to see what I'm doing, they want to be part of my research team. Even though we can't take everybody, but I give every individual, even if I'm not going to mentor you, I make sure somebody in my team can actually perform that role, because they have quite a number of people in my team that can also, do that.
Thank you so much, Dr. Kehinde Okunade, Associate Professor of Obstetrics and Gynecology, Lagos University Teaching Hospital and College of Medicine, University of Lagos. Thank you for giving us this time. We are concluding this now, and we hope to come back again with another episode of Healthy Living Podcast series. Please follow us on Facebook, Instagram. We are happy to go out there, get all the necessary information about healthy living, which will benefit all of us. Thank you again, Prof, for giving us this opportunity.
Thank you for having
We
us.
appreciate you a lot. And we wish you the best of luck, along the way, getting good results from your research. Thank you.
Thank you.
Bye for now.